So hello everyone, welcome to my new video. So today's topic for discussion is normal tension glaucoma. So what is normal tension glaucoma? So normal tension glaucoma is a subtype of primary open angle glaucoma where you will observe that the intraocular pressure of the eye remain in the normal range, that is 10 to 20, and the anterior chamber angle of the eye remain open, but then also we see significant disc damage and visual field defect is there. So if you go to the mechanisms of this normal tension glaucoma, then there is two things that we need to look at. First mechanism is IOP dependent mechanism, and second is IOP independent mechanism. So let's discuss first about the IOP dependent mechanism. So to discuss on this thing, first of all, we need to know about translaminar pressure. So our eye optic disc having lamina cribrosa through which the actions of the ganglion cell pass through. So this lamina cribrosa face two type of pressure. One pressure is intraocular pressure, another is pressure that is exerted by CSF, that is cerebrospinal fluid. Normally this IOP is quite higher than CSF. That is the normal thing. But if due to any reason or any cause this intraocular pressure goes very high, then the difference between the IOP and CSF will be higher, and this higher fluctuation of IOP will lead to direct action on the optic disc. So if this high amount of IOP remain for a prolonged period of time, then it can lead to certain damage to the optic disc that can lead to glaucoma. So that's why we say every time that IOP is one of the factor that can lead to glaucoma. Okay. Another thing, that if now suppose IOP is a normal range, that is below 20, but due to any reason or any systemic disorder the CSF pressure goes down, that means ultimately the difference between the IOP and CSF will be higher. IOP is in normal range, but CSF pressure goes down, so the difference is high. So this high difference between these two pressure will lead to certain damage to the optic disc, so it also can lead to optic disc damage. Also that's why it can lead to glaucoma. So it also can be reason for normal tension glaucoma where the IOP is normal, anterior chamber angle is open, but then also there is disc damage is there. That is IOP dependent mechanism. Now if you go to the IOP independent mechanism, then first of all we need to understand about the one thing, that is reduced ocular perfusion pressure. So this reduced ocular perfusion pressure means the difference between intraocular pressure and the blood pressure. So if this intraocular pressure and blood pressure difference is very high, then it will lead to certain damage to the optic disc. Or another thing is vascular dysregulation. Okay, so this reduce in ocular perfusion pressure and the vascular abnormality, this can lead to certain damage to the optic disc or optic nerve. Okay, so it is normally seen that suppose the patient is having cardiac issues or heart issues are there, right? So they are having altered amount of blood flow to their body and fluctuations of blood pressure. So these fluctuations of blood pressure will lead to altered amount of oxygen, ocular oxygen flow to the ocular tissue, right? So it will lead to certain amount changes in ischemic changes or oxidative changes can be there due to this alteration of the blood flow to the eye. So it is also seen that this alteration of the blood flow, there is vascular dysregulation, is quite related with normal tension glaucoma. So that's why every time when we get a patient for normal tension glaucoma, we definitely send the patient for systemic evaluation and blood pressure recording or monitoring. Another thing, like anatomically, the lamina cribrosa become thin. Okay, so this thin lamina cribrosa is not able to tolerate the fluctuations of IOP. That is normal diurnal variation test. That means the fluctuation of IOP throughout the day. That in the morning the IOP is highest, right? As the day progress, IOP become little low, and as again in the night it is quite higher. In the morning it get highest. This is the normal range. Like this is the normal diurnal variation of IOP. But in case of normal tension glaucoma, what is happening, that there is fluctuations of diurnal variation of IOP is there. That means there is not that much significant thing that in the morning IOP is higher, in the afternoon it is lower. Anything can be happen. So if the lamina cribrosa is anatomically thin, then it will not able to tolerate that fluctuations of IOP and it will lead to certain damage. So in many cases it is seen that thinner lamina cribrosa can also lead to optic disc damage. So even after the IOP is the normal range, angles are open, then also optic disc damage are seen. Okay. Another thing, like our blood pressure, there is blood pressure also have its fluctuation throughout the day. Like normally in the night there is 10% reduction of blood pressure from the daytime, so this is normal. But if due to any reason that blood pressure reduction from the or difference from the day value is more than 10% reduction is there, then this less amount of blood flow means that there is less amount of blood pressure, means less amount of blood flow to the eye. So this less amount of blood flow will lead to certain damage to the optic disc, so it also can be a reason, right? Another thing is that there is some amount some type of systemic disorders like Alzheimer disease and all those things are quite responsible for reduction of the CSF pressure. So due to those things the IOP also can lead to certain damage to the eye. So what type of investigation that you need to send if you are suspecting that the patient is having normal tension glaucoma? First of all, take the IOP by Goldman appellation tonometry. Okay. And if you are suspecting, do the gonioscopy. Okay. And to see angle is open or closed, something like that. And you need to send the patient for CCT, HVF, OCT, RNFL. Okay. So in the next video, I will upload how to interpret this OCT RNFL report so that it will be easy for you to understand or interpret this OCT RNFL properly, right? I already uploaded a video on HVF report interpretation. I hope that video is helping you all to interpret nicely. If you have any doubt on HVF interpretation, then you can text me directly or you can comment. I read every comment of you. Now, if you see certain damage to this OCT RNFL report or in HVF report, then you need to send the patient for DVT to see what is the fluctuation of IOP. And normally it is seen that normal fluctuations of IOP is in the range of 3 to 4 mmHg. Fluctuations of IOP throughout the day is very normal. But if these fluctuations of IOP is more than 6 mmHg, then it is not normal, it's abnormal. So you need to diagnose the patient as NTG. If you see that the patient intraocular pressure within the normal limit, angle is open, CCT is normal, there is significant disc damage is there is more than 0.7 cupping is there, and visual field defect is there, and DVT curve is also abnormal, surely the patient is having normal tension glaucoma. So in that cases, we definitely send the patient for systemic evaluation, and along with that, we always give the patient anti-glaucoma medication. Now you all will ask this question that if the IOP is in normal rim limit, then what is the purpose of giving this anti-glaucoma medication? So if I tell you that we don't know what is the normal pressure for that eye, even if the person is having 18 mmHg IOP, it doesn't mean that IOP is normal for that person if that IOP is not leading to any disc damage, significant disc damage. So you can't say. So in a case of normal tension glaucoma, we every time prefer to give anti-glaucoma medication to the patient to make his IOP as low as possible. And the first line treatment for normal tension glaucoma is prostaglandin analogs, because those prostaglandin analogs actually help in aqueous outflow because it is working on uvascular outflow drainage system. So it eventually reduces the intraocular pressure 30% from the baseline IOP. So now let me tell you what is baseline and what is target IOP. So baseline IOP means at that IOP where the disc damage start, that is called as baseline IOP, and target IOP means the IOP pressure where there is no further disc damage happening, that is your target IOP. So prostaglandin analogs anti-glaucoma medication always reduce the intraocular pressure 30% from the baseline IOP. So that's why we always prefer to give these PG analogs in case of normal tension glaucoma. And the target IOP that we decide is 14 mm of Hg in case of normal tension glaucoma. That's all friends, thanks for watching, and in the next video I'm definitely going to upload the report of OCT RNFL so that it will be easy for you to interpret all those things in glaucoma diagnosis. Okay, I already uploaded a video on gonioscopy, HBF. Now it's time for OCT RNFL report so that we will be very much easily able to diagnose the glaucomatous changes that happen in our eye, so that it will be easy for us to detect very early about these glaucomatous changes. Thank you so much.